Good afternoon, everyone, and thank you for joining today's update on COVID-19 in North Carolina. As of today, we have 250,592 cases, over 250,000 COVID-19 cases we've had in our state. 1,842 new cases reported since yesterday, 1,219 people in the hospital, and sadly, 4,032 people who have died. My family and I continue to pray for those left behind in the wake of this cruel virus that has taken so many Americans from us too soon. Today, Dr. Mandy Cohen, our Secretary of the Department of Health and Human Services, will cover the data on our key trends. Like states across the country, our numbers continue to be higher than we want. So our work to prevent the spread of this virus remains critical. This week, you'll see even more detailed information on the state's coronavirus dashboard, including county-level data, a new breakdown of age, race, ethnicity, and gender of people who are in the hospital, and a new report on clusters around the state. Seeing how and where the virus is spreading in our communities helps us know how to slow it. And it reinforces the sinister way this virus spreads at work, at church, and at the homes of friends and families. This week, we're also asking local authorities to step up their efforts to slow the spread in their communities. Secretary Cohen and the Secretary of the Department of Public Safety, Eric Hooks, have shared a letter to county partners encouraging ways to enhance prevention efforts, starting with mobilizing businesses, community, and faith leaders on the 3 W's. We need everyone's leadership in this moment, talking about wearing a mask, waiting 6 feet apart, and washing hands. The letter also went to counties that have been experiencing increased viral spread, and it laid out steps that they can take to slow infections. These include using civil penalties or fines for violating safety rules. The letter also proposes that some counties should consider going beyond the statewide executive orders in ways such as lowering their local mass gathering limit or ending alcohol sales before the statewide requirement of 11 p.m. Our local partners are key allies as we continue to fight COVID-19, and their work is vital. We hope our local communities can work with us to move some of our troubling trends in the right direction. I also want to update you on the HOPE program to help people with rent and utility payments. We have had over 12,000 eligible applicants for this program in less than a week since it launched. So many families are on the edge and need help just to be able to stay in their home with the lights on. People can apply for help by calling 211 or going to nc211.org/hope. As the number of applications climbs higher every day, it should make us remember that it's more than a number. Every single one of those applications represents a family having to make impossible choices between basic necessities during a global pandemic. Taxpayers can be assured that the $117 million HOPE program is in effect, as help for these families goes directly to landlords and utility companies to help ensure that people can stay in their homes. But we know the needs will surpass the amount we have. We need more support from Washington, and we need it soon. And we'll continue working on ways to support North Carolinians. Right now, I'd like for Dr. Cohen to come and to share her data and update us on our key metrics. Dr. Cohen.
Thank you, Governor. As the Governor mentioned, we've added some new data to the dashboard, and we are working with our local partners to help us fight this virus. I'll come back to these after we go through our data, so let's get started. As a reminder, every week we look at a combination of trend metrics. We look at COVID-like syndromic cases, new cases, positive tests as a percentage of total tests, and hospitalizations. Together, these 4 metrics give us a picture of where we are today. As we move to our first graph, we look at people who come into the emergency department with COVID-like symptoms. This is our earliest detection mechanism. And taking a look at the yellow line, you can see that this trend has started to decrease in this past week. But as we look at trends over the past 2 weeks, it is overall level and still too high. Next, we look at new cases. This first graph on cases gives you a look at the trajectory of cases every day since we had our first case back in March. And you can see the line has gone up quite a bit in the last couple of weeks, and that we have now surpassed our previous peak that occurred in July. But let's zoom in and get a better sense of the current picture, particularly over the month of September and October. What you can see when you look at the yellow line, that our cases are trending up. Last Thursday and Friday, we had our highest number of daily cases reported since the start of the pandemic. Next slide, we look at the percent of tests that are positive. This number has started trending slightly higher. I'd like to see this back at 5%. On our next slide, we look at day-over-day hospitalizations, and you can clearly see from this yellow line, this trend is increasing. While we have capacity, some of our smaller hospitals are already feeling the strain. You can now get more information on hospitalizations on our dashboard. Yesterday, we added demographic information about people admitted to the hospital with COVID-19. Our team and North Carolina's hospitals have been working together to be able to collect and share this information about new admissions by race, ethnicity, age, and gender. Okay, so here's where we are. Our surveillance data ticked down and is level, but still high over the past 2 weeks. It gets a yellow line. North Carolina's trajectory of cases is up. It gets a red X. North Carolina's trajectory in test return positive is up, but lower than where it was during the last time our cases were at this peak in July. This gets a yellow line. North Carolina's trajectory of hospitalization is up, but we still have capacity. This gets a yellow line. So now onto our capacity indicators. Our testing capacity is high. This gets an upward arrow. We continue to hire contact tracers to bolster the efforts of our local health department. So if you test positive, please share information about where you were and who you were near. This information is private and is never shared with a contact. And there also have been almost 250,000 people who have downloaded our exposure notification app, Slow COVID NC. Overall, this metric gets a sideways arrow. Our PPE supplies remain stable and we continue to distribute PPE across the state. This indicator also gets a sideways arrow. So look, this has been a really hard year. I understand how much everyone wants to be with family and friends without having to worry about a virus. We miss the people we love and the places that bring us joy or provide comfort. I haven't seen my parents in person, and I miss seeing them play with my girls. And I'm sad that I've never met my new baby niece. But look, we're doing everything we can to slow the spread of this virus. The simple fact is, ignoring the virus does not make it go away, just the opposite. In the past 2 weeks, we've seen an increase in COVID-19 clusters in social gatherings, things like informal get-togethers and family gatherings and parties. We've also seen an increase in cases from clusters in religious gatherings. You can see other places where we're learning about clusters in our new report on our COVID dashboard that will be updated weekly. And remember, we also have resources to help. There is guidance for places of worship, as well as a toolkit. Earlier this week, we also posted new guidance for private social gatherings. Remember, anytime people come together, there's risk for transmitting this virus. But there are steps you can take to lower that risk. And of course, it starts with the 3 W's. Wearing a mask is not about how well you know someone. When you are with someone you don't live with, wear a mask over your mouth and nose. This is scientifically proven to reduce the risk of exposing someone to COVID-19. Meet outside. Arrange tables and chairs for social distancing. Keep the group small. This guidance is on our website right now, covid19.ncdhhs.gov. We're also working with local partners. Secretary Hooks and I are asking local leaders to promote the 3 Ws and consider local actions to continue to help slow the spread of this virus. As hard as this is, it will end. We will get through this. Let's do it by looking out for one another. Whatever, get behind the mask. Thank you. Thank you, Governor.
Thank you, Dr. Cohen, for your leadership, for that update, and for the hard work that you and your team are doing. Because several of our trends are moving in the wrong direction, North Carolina will remain paused in Phase 3 for the next 3 weeks. We hope that greater enforcement, strong community leadership, and more people doing the right things can lower these numbers. It's critical that we take this time to focus on the basics. Yes, wear a mask, wash your hands, wait 6 feet apart from other people. These are the habits that helped lower our numbers over the summer, and they are still our best tools. As this pandemic continues, I know that it's tiring and difficult to keep up our guard, especially when we're gathered with people we love, but it's necessary. No one wants to spread COVID-19 accidentally to friends or family. And so we must keep prevention at the forefront. Wearing a mask shows that you care about people. It's more for them than for you. Wearing a mask is an easy way to protect our communities and to look out for each other. Confronting the virus head-on and doing our part as individuals is good for our health, and it's good for our economy. Let's keep working together. Let's keep doing what works. And let's stay focused every day on our fight against this virus. Also with me today is our Deputy Director of Emergency Management, Steve Powers, and Ryan Flynn, the Chief of Staff of the Office of Recovery and Resilience. And Mike are our sign language interpreters. And behind the scenes, Jackie Mativier and Ron Vasquez are our Spanish language interpreters. We'd invite you to ask questions. If you can yourself and your organization, we would appreciate it, and we'll begin with the first one.
Our first question is from Colleen Quigley, WNCN.
Hey, good afternoon, Governor. Thank you so much for taking my question. You talked a lot today about enforcement and strengthening enforcement, but we know that law enforcement agencies across our state have said they aren't going to enforce these guidelines. So if we continue to see a lack of enforcement and trends in the wrong direction, at what point do you say we have to go backwards in terms of the phases of reopening?
More and more law enforcement across the state are beginning to recognize that it's important for them to play a role in enforcement, even if it is an informal one, going and talking to people and being leaders in the community. We just saw the sheriff County, who had said a few months ago that he wasn't going to enforce, is now going to enforce safety protocols. In addition, local health departments and our State Department of Health and Human Services have authority under the health laws to enforce safety precautions, to make sure that we're sending the signal that this is serious and that we have to slow the spread of the virus. I'm feeling more confident that we can enforce what we have to be able to drive down our numbers. It really takes people working together, but I think more people are recognizing that it's important for us to do that. Dr. Cohen, would you like to add a word or two? Okay. Next question, please.
Our next question is from Thomas Waybrecht with WITN.
Hi, Governor. Thank you for taking my question. I feel comfortable telling my friends, telling my family, they should be wearing a mask out in public whenever it's, required. But when I'm in the store or at a restaurant and I see others not doing that, I don't know what to tell them. What should we tell strangers or tell people who are endangering the situation as someone who doesn't know them, just to help?
Great question. And I know it's frustrating to be out there in a store or in a restaurant or seeing people who are not complying with the rules. When you're in a retail establishment, I recommend going and telling one of the employees, or even more preferably the management of the retail establishment, that someone is not complying with the rules. I don't think you necessarily have to take it upon yourself. And a lot of these businesses are doing more to make sure that their employees and their customers are protected. In my conversations with businesses, I've encouraged them to do this, to be forceful. A number of law enforcement have said, although we may not necessarily enforce the mask mandate itself, if we get a call from a retail establishment saying that someone is there who will not wear a mask, we will go and use the trespassing laws to try and remove or to cite that person that's on the retail establishment. So I think you're seeing more and more businesses understand that they need their own employees protected, they want to protect their customers, and it increases the bottom line, because the vast majority of people who go into retail establishments are safe. And the vast majority of people in this state understand that wearing a mask and social distancing will keep everybody safer. So I'd recommend telling the management and just continue to set the example as being a leader in your community. Hopefully getting past this election will help us come together on this. I know that this has been involved in the process, and that's a frustrating thing. But I do believe that most of the people of North Carolina do want to slow the spread of this virus, and they understand that collectively we have significant power to be able to do that. Next question, please.
Our next question is from Richard Kraber, Winston-Salem Journal.
Hello, Governor. This is Richard Kraber with the Winston-Salem Journal. I had a couple of questions for you. Actually, one for you and one for Secretary Cohen. The question for you is that since the announcement came out earlier today about trying to enlist the help of local governments, local communities to help reinforce the social distancing guidelines, including maybe tighter restrictions, you had Lieutenant Governor Forrest come out and basically talk about this is some sort of abdication of your responsibility for these restrictions. And I wanted you to comment on that. And then for Secretary Cohen, given that by the time the next potential ending of phase 3 is in the middle of November, and we're going to be more indoors and more toward the middle of flu season, if there's a certain metric y'all are looking at now in terms of further tightening restrictions.
Thanks for the question. What we're doing now in working with local governments to slow the spread of the virus is no different from how we started this thing back in March and April and June. We set a floor with statewide restrictions, but at that time we also encouraged local governments that if they were seeing more viral spread in their community and if it worked better for their community, they could use restrictions that are greater than the state floor. And a number of our cities across the state did that, and it helped us to slow the spread of the virus. What Secretary Cohen and Secretary Hooks have done has sent a letter to local governments, particularly into the counties that are having problems. We now have the county data broken down. And particularly some of our areas, hospitals are becoming a little more strained, and we're seeing more viral spread. And we wanted to remind local governments that they do have that authority to do more than the statewide floor and to attract or to attack the virus specifically in their communities. It also encouraged them to come together and to bring in leaders to set the example of wearing a mask and socially distancing and washing hands and doing the things that we need to do in addition to enforcing the safeguards that we have in place right now. Dr. Cohen?
Hi, Richard. Thanks for the question about what we would look at as we move into November. And as we talked about often, we have to look at a combination of metrics. It's why when we go through a data day like we did today, we look at all of those metrics. We obviously know that our cases are going up and are at some of our highest levels that we have seen since the start of this pandemic. We see our hospitalization going up. But we also see the percent of tests that are positive is lower than we were back in July. We saw the early surveillance warning data tick back down this week. So again, we have to look at this data over a period of time. We look at it over 14 days, and we have to look at them in combination to understand how they influence each other. What I would say, as we do head into colder months, where we know with lower temperatures and lower humidity, the virus likes to spread, and it's going to have more opportunity to do that, particularly as we move activities indoors. So as we think about moving into this next period, I am concerned that our cases are going up at a time where we are also seeing those lower temperatures and knowing that we're going to be doing more activities indoors. I think that's why we wanted to remind folks that we're already seeing more of a spread in these informal or social gatherings, right? We often think, oh, I'm just with my family or some really close friends. You need to be wearing your mask anytime you are with anyone outside who you live with in your household, anyone outside of your home. So I think if we focus on what the governor's been talking about, enforcement and the 3 Ws in all settings, I think we will be able to hold steady with our trends and continue to live with this virus. Thank you.
Thank you. Next question, please.
Our next question is from Dawn Vaughn with the News and Observer.
Hi, Dawn Vaughn of the News and Observer. I wanted to ask about reporting and again about law enforcement and enforcement of the mandates. Are there going to be any penalties associated with agencies that aren't enforcing the masks or other restrictions? And then I know a lot of people will be looking at the new data gathering clusters. Why is it still only child care, schools, and congregate care that are mandated to report? Why not expand that to other places?
Well, as to law enforcement, as I mentioned earlier, some already are very engaged in this, and others are getting more engaged, understanding how virus spread is happening in their communities. So you're seeing more and more law enforcement talking to people, reminding them, and we're also putting the onus on the retail establishments to make sure that the people who are in their restaurant or grocery store or drugstore or whatever it is, that all of them are wearing the mask. Our health departments and our Department of Health and Human Services also has authority under the abatement provisions, and Dr. Cohen can talk with you a little bit more about that, but that has already been used in some circumstances, and we anticipate that that's going to be used more in the coming days, particularly working with local health departments to send a strong signal to businesses that it's important for the health of the community and the economy of the community for them to take steps to slow the spread of the virus. And I'll let Dr. Cohen address the rest of that.
Hi, Dawn. Thanks for the question. You're exactly right in terms of there are certain entities that are required by law to report a cluster to us. And a reminder, a cluster is 5 or more cases. And if they're required to report them to law, like a school, a child care setting, a long-term care setting, and another congregate living setting like a homeless shelter, folks are required to report that to us, and then we do post that information on a weekly basis on our website down to the name and address of that location. But that is not for every business, and so, but we do want folks to have an understanding of where these clusters are forming. And we want folks who are seeing a number of cases to reach out to their local health department, because we want to work with you. We want to make sure we are breaking that chain of transmission, and there are things we can do to work with you, whether it's a restaurant or a religious setting, or even it was a party at someone's home. So we are encouraging folks to pick up the phone and work with your local health department on these clusters that we are seeing of cases. But we do wanted to give some folks an idea of it. They're not required to report to us, so we know that it's likely an undercount of what the clusters are out there, but at least gives you a sense of where we're starting to see at least 5 or more cases starting to spread around the state. Thanks.
Next question, please.
Follow-up, Dawn Vaughn, News and Observer.
Thanks for taking the follow-up. So I guess there won't ever be an extension of who has to report. Is there another way to do that, or to advise that, or some other way?
Thanks, Dawn. And in a review of states across the country, actually North Carolina has some of the most strict reporting requirements already for entities. And particularly as we look at schools and we looked around the country, the fact that we are able to get mandatory reporting from our school settings and then be able to share that back with the public, I think does put us already at the end of places where we're able to be incredibly transparent. And again, we'll continue to work with folks on reporting. And again, just to reiterate that this virus is spreading in any situation where folks are close together and not wearing masks. And I think that's what is evident in some of the cluster data that we're reporting out today. Thanks.
Next question, please.
Our next question is from Michael Hennessy, WGHP.
Hey, Governor Michael Hennessy from Fox 8 here. I have a question for you as well as a question for Dr. Cohen. When it comes to schools, as we saw at the beginning of this pandemic, you have the power to close the districts. Specifically here in the Piedmont Tribe, you've seen several of our local districts pushing back their starts. Are you considering going back and doing a baseline similar to what you did at the beginning? And then for Dr. Cohen, you talked about a lot of the data, what you guys are seeing in certain settings, but we're curious really what that specific data is. And several health leaders are pointing to things like restrictions, maybe people just getting tired about that. What is that specific data, and is that something that we'll be able to see as you guys continue to expand your dashboard? Thank you.
We're continuing to monitor the data and continuing to talk with educators, teachers who are in the classroom, principals, administrators, school board members, and health officials about schools. Our number one goal is to get our children back safely into our school, into in-person learning. But we know that in a number of parts of our state that it is not safe to do that 100% yet. So as of now, we're continuing to provide the 3 options that local systems can choose. The first option is all remote learning. The second option is having a combination of remote learning and less density in in-person classes. And the third option is allowing K through 5 to be able to go back to school fully in person there as well. And we see schools all over the state adopting all of these options depending on where they are. And we hope that this county data that we're going to be able to provide to them can help them as they help to make decisions. We certainly are going to continue to monitor to see if we need to do anything differently from a statewide perspective. And if we need to do that, we will, as we did in March earlier this year. But I think it's important that we continue to strive to get our children the very best education that they can. It's why we're putting it in overdrive to help with hotspots and connecting students to rural high-speed internet access is one of the reasons I proposed a bond to do that. And we're doing everything we can to help train teachers to help them deal with this new situation of having to teach sometimes remotely. All of these are amazing challenges that are being faced by schools and parents. And I know it's tough on the parents to have children home longer than they're used to having them. But our mission is to try to get these children back into school as quickly as we can. And one of the best ways to do that, if everybody would pull together and wear masks and social distancing, we can slow the spread of the virus and speed that process up of getting our children back in school. Dr. Cohen, I'll let you address the next question.
Thank you. The only thing I'd add on schools before I go to the other question is that we know much more about how this virus is transmitted in children. We know that children, it seemed to be under the age of 10, seem to get this virus less often. They get less sick, and then they also transmit it to others less frequently. Doesn't mean never. Kids can get sick, they can have symptoms, and they can transmit it, but it's much less. And I think that we have used that science and evidence to inform our decision-making about schools, and we will continue to update our understanding as new science has learned about that. And as far as other data on our dashboard, I'm not sure I 100% understood the question, so I apologize, but there is a sizable amount of data that helps you understand where this virus is spreading most. Some of the new data that you can see that the governor was talking about at the county level. Before, you could see the number of new cases, of course, at the county level, and you could see that at the zip code level. But what I think is new that helps folks really understand things is you could see it in some different time sequences. You can see what's happened in the last 24 hours, the last 7 days, the last 14 days. And again, gives you the ability to look at trends over time and understand what's happening in the community. We're also putting up a report about clusters in some various settings. It's where we've shared today that we're seeing an increase in these informal social gatherings. We're seeing an increase in religious settings. So I think that helps you understand a bit more about where this virus spreads. But overall, we're not necessarily seeing one geography or one age group or one type of setting that's driving this. The virus is everywhere here in North Carolina, and that's why you keep hearing us give these messages of we all have to work together on the 3 Ws. There's no place in North Carolina that can let down their guard at this time. There are places that have to work even harder than they are because we see the virus spreading a lot, but no one can let down their guard given what we are seeing in our data. But I'd encourage our local leaders in particular to go to our dashboard to really examine what we're seeing in the trends, and then we'd be happy to work with you to tailor to what's going on in your community. Thanks.
Next question, please.
Our next question is from Michelle Boudin, WCNC.
Hi, Governor. Thanks so much for taking my question. I apologize to pivot right now, but we've been trying to get to you for a while. So my question is, back in August, the courts threw out Ronnie Long's conviction after he'd served 44 years in prison. And at this point, his attorneys have been asking for a while that you pardon him, sort of paving the way for him to get some relief after 44 years. What can you tell me about your plans to deal with that pardon request?
We are going to consider any requests that we get carefully. I served 16 years as Attorney General and helped set up the North Carolina Innocence Commission, which was the first of its kind in the country to be able to determine whether people are actually innocent of their crimes. And that has worked, but obviously needs some improvements. My task force that I've set up on racial equity in criminal justice is working on a number of recommendations that I look forward to seeing. But that petition from Mr. Long, which I think was received a week or so ago, will receive careful consideration by me and by my office. It is a significant power of the governor to be able to make decisions about what a judge and jury have done. And I take that power under the Constitution very seriously, but we'll review that application along with others. Next question, please.
Our next question is from Travis, WRAL.
Yeah, hi. Correct me if I'm wrong, but I believe the Abbott fast-acting antigen tests received from the federal government are headed out this week to various counties, and my understanding is you're going to focus on hotspots where the virus has been spreading rapidly. Can you drill down a little bit more as to what the purpose, the hope for those are? Will they be used particularly in schools or particularly in nursing homes? How are those tests going to be used, and how will they change things, if at all, when it comes to the state's response?
Received these from the federal government, and these are a little different than the tests that we have been using, but I'll let Dr. Cohen tell you a little specifically about what we're doing with those tests. Dr. Cohen.
Thanks, Travis. Yes, we have received what's called antigen tests, which is a slightly different test, as the governor has said, from the federal government. And we have been distributing those through our local health departments. We have to understand about these kinds of tests, different than others, is they're meant to be used in situations where we think someone may already be positive. They have symptoms, there might be part of an outbreak. And we are still learning about the best use of this. We are right now targeting the use of these tests to outbreak situations, whether that's in a school or any setting within the counties. So we have shared those tests, and we have already distributed the ones we have gotten to our local health departments to have them use in various settings. We are trying to target them to those who are at higher risk of those outbreak settings, because again, it's not meant as a screening tool, not meant as a screening test. It is meant to be used similar to how you would go to the doctor and get a rapid flu test or a rapid strep test, if anyone's done that, right? You come in with symptoms that might seem like the flu, the doctor does or a nurse does the rapid flu test, and then you get that result back. It's sort of the same kind of way in which you would want to use these tests. If you're having symptoms, if you have a higher likelihood of actually having exposure or having this virus, that's when this test is pretty good at picking up the virus. If you get a negative test, it doesn't necessarily tell you as much, and that's what we're still learning about. What can we do with the negative test, and what is the next step for someone if they do get a negative result from one of these antigen tests? I think more for us to learn as we go through this, but again, good to have another tool in our testing tool belt here as we go forward.
Next question, please.
Our final question is from Brian Anderson with the Associated Press.
Hi, Governor. Hi, Dr. Cohen. Brian Anderson here with the Associated Press. Thanks for the time. I had a question for both of you. First, for Dr. Cohen, I understand correlation and causation aren't the same thing. And having said that, I'm just curious how the transition to phase 3 has contributed, if at all, to the increases in the state's key COVID metrics. And for the governor, people are concerned about the rising case count, hitting all-time highs of last week twice, percentage of cases positive going up from around 5 to 7%. And it's clear that there's fear of the weather conditions impacting viral spread. So why are you extending your current executive order rather than tightening restrictions at a time when the science is telling you that conditions are worsening?
Well, first, we are pausing in phase 3, and we're not going forward with easing safeguards because of the concern that we have. Secondly, we're working on increased enforcement. We have safety precautions that are in place that some people are not complying with, and we believe that enforcement will help us to slow the trends. Third, we're working hard to bring community leaders together and re-emphasizing local government authority in areas where this virus may be more of an issue than in other areas of the state. And we're hoping that all of that can help us stem the tide that we see coming at us. The good thing about our state is that we have been able to do a little better in saving lives and reducing the number of infections because of the strong actions that we have taken. And we want to be careful about how we approach this along the way. But we know that these numbers are not where we want them to be. We aren't in the middle of a spike, and we haven't seen one yet in this process, largely due to the people's persistence out there and to the strong action that we've taken. But we will continue to watch these trends, and we'll do whatever is necessary. And I'll let Dr. Cohen address the phase 3 issue.
Hi, Brian. Thanks for the question about did phase 3 contribute to the increase in our numbers? And what I'd say is I go back and look at our trends over the last number of weeks. We know that it takes some time for an action like easing of restrictions for phase 3 for them to show up in our numbers. And actually, our trends started to go up over these 3 weeks. And so I think that phase 3 may have a piece of this, but it's not exclusively related to phase 3. I think largely what we are seeing is a combination, as I was mentioning before, folks that are fatigued. They're not doing the 3 Ws. They're not particularly in social and informal gatherings. We need to be sure that we're being vigilant and doing the 3 Ws there. So again, not one thing, not one setting, not one geography, and so that's why we have to work hard together. So I certainly think that a signal that we moving forward in phase 3 may have not just eased restrictions on a few businesses, but may have folks like put their guard down a bit. And I think that's the thing we want to make sure that folks are putting their guard back up, being vigilant as we go forward here. Thanks.
Okay, everybody, thanks for joining us today. Let's work hard and look after each other. Thanks.